Thanks for inviting me. My name is Dr. Katherine Alarcón. I'm really thankful to be here. Today, I will talk about gender and outcomes in non-small cell lung cancer and all prognostic variables come back for targeted therapy and immunotherapy. First of all, let's start with introduction. We have that lung cancer is responsible of 1.6 million of deaths every year, where tobacco smoking is the main risk factor. While lung cancer has historically affected primarily men, the difference in the incidence of lung cancer between genders has narrowed over the last years. Differences are also observed in lung cancer susceptibility after tobacco smoke exposition higher in women. The difference in the clinical outcome between male and female patients with a non-small cell lung cancer is well known and has been addressed in several reports where women have decreased risk to progression and death, even when adjusting for age, histology, and stage. Because the cancer corresponds to a heterogeneous entity, differences in response to treatment and outcomes could be related also a differential distribution of clinical pathological features, for example, smoking status, histology, and EGFR mutations. In a previous work in this studio, we analyzed gender-associated differences in immune gene sets enrichment in SCLC, where regardless of the smoking status or histology, women had higher expressions of gene sets associated with immune processes. As gender influences innate and adaptive immune responses, immunological differences could be behind the differences in outcomes observed in some malignant diseases. Some therapeutic strategies involve manipulating the immune system, while the immune system per se helps to model cancer evolution, determining differences in tumor aggressiveness and response to treatment. In this paper, also, we explore gender differences in outcomes and treatment effect in clinical trials evaluating target therapy. Now, let's talk about the methods. First of all, we have meta-analysis. The meta-analysis was performed using the RevMen V.5 program. Also, for overall survival and progression-free survival, we extracted the logarithm of HR and the CE using the values of this that I mentioned from the reports of interests. A random effects model was chosen for the meta-analysis of comparison between genders because of heterogeneity of periods of time and treatment assumption for the evaluation of target therapy in clinical trials. Also, we have the meta-analysis for gender differences in OS and gender-specific benefits from target therapy and immunotherapy in terms of PFS. We have the results, and the results improve OS in female patients in data from the settings. In total, 7 studies for OS multivariate analysis were identified because one study included 5 periods of time. Every period was evaluated independently in the meta-analysis with the random effects methods, and HR was equal 0.73 was obtained favoring female patients, comparing the data from men. Also, we have the effect of gender in the way from target therapy and immunotherapy in terms of PFS. And in total, 931 female and 494 male patients were evaluated in six-phase third trial. The meta-analysis in male patients showed an HR that was equal of 0.44. That means 95%. And when women were evaluated, the meta-analysis showed an HR that was 0.34 equal to 95%. It means that we had the same data, but we also have an anti-ALK inhibitors in four randomized phase third trials. 751 female and 536 male patients were evaluated, and the meta-analysis resulted in a HR 048. It means also 95% for men, favoring ALK inhibitions without heterogeneity between trials. And we also in the paper had a short box where is specific specificating um, each of randomized phase third trials, but I can show it, but I can explain it. And um, also we can find some benefit from cetuximab. It's an anti-EHFR antibody between genders in the subgroup analysis, and also in the review of other biological agents. Um, we also has some contradicting results because, for example, in the first phase, we found that women has has some more data than men, but in the second phase we found that they were equal, and the third phase we found that male had a highest percent. So there are the contradictions that the study are mentioned. And in regard to analysis of ALK inhibitors, a similar benefit was observed between genders, although there was observed a high homogeneity in the analysis of both genders, on both genders. Um, Also, when we evaluated anti-PD-1 inhibitors, the meta-analysis in female patients did not show a clear benefit from these agents when we compared with chemotherapy. In contrast, male patients have 24% reductions in the risk of progression. Although this is an exploratory study, our finding raises the questions about the value of genders itself as an independent prognostic factor for anti-PD-1 or anti-PD-L1 blockade. A possible explanation of these differences is female patients could bear lung tumors with enriched intrinsic characteristic of resistance or mechanism. Immunity of women is more active than men, producing a different effect to PD-1 blockade. And finally, we can mention about that the biological point of view to improve the immune therapy in women. Precision medicine has put in the mind of oncologists to genomics as the axis of drugs prescriptions. However, there are classic prognostic variables that can be taken in consideration for precision medicine. Gender is one of the oldest prognostic variables in oncology that is being more than and more time left behind the current research. Gender should be analyzed deeply in current trials because biolo- bio- biological differences could compromise response to target drugs. We also um, we also can mention about the clinical practice points. Since the beginning of the use of anti-TKL in NSCLC, the female gender was associated to better drug activity. Then this variable was lost in the large amount of data involving genetic aberrations used in the correct context of precision medicine. To conclude this video, the results of our exploratory analysis suggest the need to reevaluate the influence of gender in the treatment effect in retrospective and in a prospective controlled fashion in a subsequent clinical trials of immunotherapy and targeted therapy. This is very important now that we are advocating for a personalized and cost-effective medicine. Thank you for your attention.